Hi guys, this video is about meniscus strains and tears, and I'm going to cover quite a bit in this to explain to you exactly why it happens and how you can get it better. So we're going to look at the anatomy of the knee so you understand what the meniscus does exactly, then the mechanism of injury. We're going to look at whether meniscus tears heal and whether it actually matters whether they heal or not. We're going to look at treatment options available, recovery times, general advice that can make your knee feel a lot better within those first 2 weeks where it's really painful, and then we're going to look at the rehab process. Lastly, there's also a question from one of the group members from the sports injury group that I will answer in a little bit more detail then. So for those of you who don't know me, my name is Maryke. I'm the physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries. So have a look at the description of this video if you want more information about that. Excellent, so let's dive right in. Let's look at the anatomy. There we go. So there you can see the knee, and to just orientate you at what you're looking at, you've got the femur from the top and your tibia at the bottom. That forms the main knee joint, and you can see the kneecap there over the top of them. And I don't know if you can see it, but there are two little blue discs in between this joint space, and those are your meniscus, and you'll see it on there. It says lateral meniscus and medial meniscus. So to show you on my own knee, if you looked at the knee from the front, if you've got the bottom of the kneecap, you can feel the point of the kneecap, you just go down from there. That's your knee joint line, and your medial meniscus lies into this bit and lateral meniscus into that bit, and they are C or horseshoe shaped cartilage discs, and what they do is they help the bones to sit better on top of each other, and they also cushion the forces in the knee, so they act as shock absorbers in the knee. They resist rotation forces to an extent as well. So you've got a medial one and a lateral one, one on the inside, one on the outside, and basically you can get a tear in any part of it. So if you look at the, imagine this is the knee joint, can you see that depending on how much you bend your knee, you will either place more pressure on the back of the meniscus or the posterior part of it, or on the front of it. And then also if the knee tilts in, there's more pressure on the inside, so medial meniscus, and out, more pressure on the outside. I think that's about the most important parts that I need to cover in anatomy. Now, mechanism of injury. It's usually a twisting motion or a deep kneeling action. So in sport, most often than not, it involves a twisting motion or stepping off something quickly, or just kind of tripping over your own feet type thing, or somebody makes you fall. But you can get an acute one where it happens suddenly, traumatic, or you're just doing some activity that's not really much. Like for instance, one of my patients just bent down, he was getting logs out for the fire, and he felt a sharp pain in his knee. That type of tear is usually due to overuse, that you've really worked it hard in a way that it didn't want to be worked over a long period of time, and then a simple movement like deep kneeling then causes it to tear. You can also get it that the meniscus is just really sensitive on the inside, and again that's through repetitive strain. So if you've got poor biomechanics, that you walk in a way or run in a way that strains that bit more, it can become really sensitive there. But most often than not, it's a twisting action that causes the injury. And this is important because when we look at treatment, you want to keep that in the back of your mind, because if you can avoid twisting actions, it can really make that knee feel a lot more comfortable. So let me just make sure I've got everything I wanted to say there. Okay, so now, by far, the most common question people ask me is, can a meniscus tear heal? And usually the reason that they ask me that is that they've read on the internet that meniscus has very poor blood supply and they don't really heal, blah. Now, a few points on that. Yes, it has a poor blood supply because nothing in the joint has a blood supply. It relies on fluid inside the joint, the synovial fluid, to get its nutrients from. So it needs movement to get fluid and nutrients in and out of it. So it's designed with a poor blood supply. So you don't need a massive blood supply to get your meniscus healthy. You just need really careful movement and the right nutrients. Second of all, the interesting thing is that we don't know if meniscus tears heals. We don't know if they knit together because they scan you to see what the problem is. They don't ever really scan you again to see, oh, has it now healed? But what we know from the research is that you can scan two people. One will have pain in his knee, the other will not have pain in his knee and not really even remember ever having much pain in their knees. And both of them can have a meniscus tear. So what that tells us is that you can have a meniscus tear without any pain. The fact that it's torn does not mean that it's going to be painful. Then also, I've had loads of patients where they've had meniscus tears, we've rehabbed them fully, they're back to full sport, they get another type of injury or something else years later in their knee, scan comes back, it still shows the old meniscus tear, and then it shows whatever else is going on. But they've never had trouble with that meniscus tear again. So it shows us that even if those ends don't knit together, it doesn't matter. You do not have to have pain from that tear. It can calm down fully and you can function fully. So it's just that acute tearing incident that causes the pain, swelling, inflammation and the healing process or the injury process to happen. But once that's calmed down, it can be a functional knee. So try not to worry about whether it's healing or not healing. Go according to your function. How much more can you do today than what you could do yesterday or last week? Okay. Which brings us to treatment options. Now, when I first started studying physiotherapy, which is now 17 years ago that I graduated, I think, meniscus tears often in that period would be seen as something that needed surgery. And surgeons would go in and they would trim the bits that was torn. They don't really fix them, by the way. So they tend to do meniscectomies where they trim bits away or they cut so they take some of it out. Now, if you think of the fact that a meniscus is designed to absorb shock in your knee, what's been shown through the research is if you do a meniscectomy, you're much more likely to get arthritis in that knee. So it makes sense because you're taking the shock absorber out. Also, as soon as you take part of it out, you're changing the biomechanics in the knee of how it carries its weight. So recently, they've done quite large studies where they've shown that actually there's not much difference if you follow somebody up for a 2-year period, people who has had meniscus surgery versus ones who hasn't. You get to a 2-year point and there's not much difference in what they feel in their knees. So there's same percentage of people who's had surgery and not surgery who still has pain, same percentage of people who actually has really good results, don't know about any pain, and some who has a bit of an iffy knee. So a recent study in the British Journal of Sports Medicine showed that 2-year follow-up, same percentage of people or same outcome at 2-year follow-up, but then also interestingly enough, 19% of the people who were in the group that was following the rehab program and didn't have surgery, they did actually cross over to have surgery because they weren't happy with their knees, but they didn't find any extra benefit from it. So surgery is not necessarily a golden fix for knee pain and for meniscus injuries. I will say this though, that I have had patients who continue to have trouble even though they tried the rehab program and they've gone for surgery and had really good results. And especially the ones where you can get a bucket handle tear, where the tear turns back on itself and then the knee gets stuck. If you haven't regained your full range of movement within 4 to 6 weeks, I would definitely go and consult a surgeon that they can have a look at that, because you don't want that knee to become tight or stiff. So I'm not going to say you shouldn't have surgery at all costs, because there's definitely people who do benefit from it. But if your knee regains full range of movement or relatively full range of movement within the first 4 weeks, I would go for a good rehab program first. Follow that for 3 to 6 months. As long as you see small improvements, stick with it before you decide to have surgery. Delaying surgery for the normal person out there is not going to mean that you're going to have a worse outcome for your knee. It's only if you've got a bucket handle tear where the knee is stuck that I would say surgical opinion is really important within the first within a short period of time. But otherwise, delaying your surgery and trying rehab and things is not going to make any difference to the outcome. Okay, so let's think about recovery times, because this is quite important for me. A meniscus injury can take a long time to get better. You get mild meniscus strains, and especially in younger people, where within 4 weeks they can be better. But if you're thinking older people, and unfortunately older people, anybody over the age of 35 to be honest, it can take a long time. I've had some patients where they definitely didn't want surgery. I personally thought that actually, you know what, this knee is giving you so much trouble, I would go for a surgical opinion, but they were adamant they weren't going to go for surgery. And their pain levels were quite hectic and restricting their movement and stuff for up to 3 months, and only then they started improving. Then I've had other patients where they've just been so hectic with wanting to get better that they tried to do the rehab, really force the rehab. It's an injury of a structure in your knee that carries weight and has to absorb shock. So if you're going to try and, because you've heard you've got to do rehab on it, loads of squats, loads of weight bearing stuff, that's not at the right level for your knee. You can actually just keep the pain going and aggravate it more. So it's quite important to get some guidance as to what is the right level of exercise for you to be doing with it. So long and short of it, recovery times can vary quite dramatically. But as long as you're seeing small improvements, it means rehab will likely work for you. But the best way, if you want to know whether it's the right route or not, is if you work closely with a therapist who can honestly gauge and measure you, because it's sometimes quite difficult to notice short changes day to day if you're the person with the injury. Now, general advice, which is, I find this quite useful advice for the first 6 weeks especially. Because remember, if you injure something, you've torn part of that. Even if it's a small tear, there's some fibers that would have been torn and painful. So you want to offload them and give them relative rest. So it doesn't mean that you're resting it fully, because that's not useful. You've got to start using it gently. But you want to avoid the really painful movements and the movements that's going to strain it specifically. So what I tend to tell my patients is to avoid twisting on the leg. So you know that action where your foot is stuck and you twist your body? That really can hurt a meniscus when you've injured it. And that's, to be honest, one of the diagnostic tests as well, if it's painful when you twist the knee. So avoid planting your feet and twisting on you. So if you want to turn your feet with your body. And then the other important thing is avoid deep squatting or kneeling, because that also pinches it and can make it painful or keep the pain cycle going. So watch those two things. And hand in hand with that goes avoid walking on uneven ground. So especially if it's your medial meniscus, because it takes a lot of strain if the knee turns in or the leg turns in while you're walking. That part will take more strain, and it's connected to the deep medial collateral ligament. So any force that strains the ligament also puts a bit of force through the meniscus. So if you want to go for walks and things, keep it on level ground and don't go on uneven or muddy ground or anything like that. You'll be amazed at what difference that makes. Another thing with regards to walking, if you may find that walking down hills is quite tricky, and that's because there's a lot more impact going through the knee when you go down hills. So just be a bit clever. You need to move because the knee joint doesn't have arteries going into it. It relies on fluid, it relies on movement to get fluid in and out of it, and that fluid provides the nutrients for the meniscus and the other structures in the knee. So you need movement, but you need clever movement. Okay, so try and identify what it is that it likes. Now, that takes us on to rehab. There are a few, I'm going to explain a bit about specific exercises as well, but it's very difficult to say you have to do this exercise this many times, blah, 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 because it will really depend on your specific injury. A squat, for instance, can be done in so many different ways with regards to how much you bend your knees. So are you sticking your bottom out to the back? Does it prefer your knees to go forwards a little bit? How low you go? Do you do it with your bum against a wall or something like that? So there's lots of different little tweaks you can do to an exercise to offload that injured bit and make it more comfortable while you're strengthening it. But what I'm rather going to do is I'm going to explain the principles behind how you choose your exercises. and so that you can get an understanding of how you want to progress through this. But let's start first with, I said this earlier, but I really want you to take note of this. Just because the best treatment for a meniscus strain is likely rehabilitation exercises doesn't mean that you need to go and really train it from day 2. All acute injuries requires a short period, 3 to 5 days, where you're really nice to it, where you just move it gently through its range of movement, keep it going, but you're not necessarily doing strength training. You can do things like isometric quads where you just straight leg raise, things like that. But rehab exercises comes as a whole wide variety of things. Okay, so even things like just doing this type of motion to get your range of movement back, that counts as a rehab exercise if it is at the right time that you're doing it. Or just straightening it out, holding it straight, counting until 10 to get your quads activated. If this is in the acute phase of rehab, that's brilliant. That's exactly what you should be doing. If, however, you're 5 weeks after injury and you're still doing that, you're wasting your time. You should be doing other things to get you stronger already. Okay, so it depends on what stage you're in. Now, you want to get your full range of movement in the knee before you attempt any strong things really. So you won't get that last flexion or that last extension necessarily, because those things takes quite a bit of strain, and it'll gradually come over 6 weeks. But you want to get a decent range of movement in there. So I tend to get my patients to just every now and again just move the knee gently. It may not like you trying to lift it up in the air, so then slide it on bed, but just keep it moving. Okay. Then, if you can do something like cycling or swimming but without pain, it can be a really useful source of loads of movement but without compression, so we're feeding the joint. Not everybody's meniscus tear can handle cycling. It will depend on which part of the meniscus you've injured, but also your position on the bike can influence it. So make sure that you don't just get on the bike and go, I can't do this. Adjust the seat, adjust the pedals, see if you can play with it. If it is an acute tear, I would probably try a stationary bike rather than one out on the road, because otherwise you may have to stop quickly and that can cause further injury. If you're going to try swimming or walking in a pool, just avoid breaststroke legs, froggy legs, because that rotation movement can put quite a bit of pressure on it. While I'm thinking of it, you know how one swings your legs out of a bed? Be careful with that at the beginning as well, because that loose swinging action of the legs can often annoy it as well. So just support it a little bit, but just for the first few weeks. Good. So what am I leaving out there? So if you can do bike or swimming without pain, brilliant. And if the legs doesn't like to move in the swimming pool yet, put a pull buoy between it. Swim with your arms mostly. That will also, just the fact that you're moving will already be good for it. Okay, so if we look at rehab exercises, you're going to start with low load stuff. So the first things that's really useful is just starting to tense your quads, get them working, tense the hamstrings, the glutes and things like that for the first week or so. But then we want to work them a little bit more heavily. So you can use the exercise equipment in the gym, like the knee extension machine, the leg curl machine. Those can be quite useful to get good strength through the body. But you definitely want to include things like the squat motion. And the reason for that is when we look at meniscus rehab, we really want to work on the control that you have over your leg as well. Because if you run with your leg turning in excessively or adducting, moving in excessively, then you're going to put more strain on your meniscus. So when you do any squatty or lunge type exercises and stuff, you always want to look at your form that you use. Now, what do I mean with form? It is basically, and I've done a video of this, a short one. I think if you put in hip control and search in my videos, you'll find a test for that. So if we look at leg movement and we think of the squat action, so when we run, it's essentially a single leg squat that you do over and over again. So when you do a single leg squat, you want to see that your knee moves in the middle of foot, pelvis stays nice and level, and it doesn't turn in, so it stays nice in alignment. A bad single leg squat would look something like that, because that's that will, can you see how that would put more pressure on there? But we start retraining it with double legs. So when you do your squats, and it may even be a little squat to start with if you have a new injury. So to show you how low I'm going, I'm just going to there. And that counts as an exercise if that's all you can do pain-free. But what I'm thinking about at this stage is I'm thinking of my control. So I'm thinking, is my knee moving in line with the middle of my foot? Why does it look as if I'm putting all my weight onto one side? Is my knee moving in the middle of my foot? Are my knees turning in? Then I should make sure that they don't. Can I keep everything nice and level? The balance exercise you're going to do is going to be about, can I keep my pelvis level? Can my knees stay in line? Does my foot stay nice and stable when I do that? So if you're balancing and you're finding that you're doing that type of thing, look at yourself in the mirror. So from the first day that you start your exercises, get it in your head that you want to see your pelvis level, knee move in line with hip, move in line with middle of foot. And that kind of goes for all the exercises, and I'll discuss which ones you want to do in a minute. Always start with double leg stuff until your knee is pain-free with them, and you can do it with a little bit of extra weight. Then you move on to single leg things. Like for instance, if you did a double leg squat, you want to work towards a single leg one, but you can't go from double to single just like that. I usually prefer to do like split squats where my one leg is supported, so you've got a bit more stability. Or static lunges where you just dip in and out and get yourself to teach that movement first. That type of thing. So you're working in straight lines, we're working from double leg to single leg. Then once you're good with single leg, you also want to start being more dynamic. So then you'll do squats where you get into the position and out of the position, or into different positions, or you'll do step ups for instance. But you'll see they're all kind of variants of squat or lunge type movements. But you go from really stable double leg, small range, get the full range through that, make them heavier, migrate to single leg stuff, and then go on to dynamic stuff. But at the same time, you want to start working on your balance. So simple balancing exercises to start with. Balancing on one leg. Can you balance on one leg moving your head? And it becomes more and more challenging as you go on. So things like single leg deadlift, for instance, is a good challenging one for later on. So if we look at the muscle groups you want to be strengthening, definitely quads, because the stronger your quads are, the more they can offload your knee joint for you and the better control you have there. So quads, anything like squats, lunges, knee extension machine, they will all strengthen that. Hamstrings you want to strengthen, as well as glutes. So if we think of easiest thing to strengthen both of those are bridges. So glute bridges, feet on floor, high bridges, single leg bridges. We're thinking deadlifts, we're thinking single leg deadlifts, anything like that. But you've got to progress again from double leg stable, small range, as the knee improves, increase range, to single leg, to more dynamic. What am I leaving out? That's it. And then once you've got good strength, once you've got good control through that leg, then you can start migrating to running programs. And you usually want to start with run walk programs that you just, because again, the running acts as a strength stimulus. But if you go into a continuous run and you've not done it for months, then it may be too much and it may injure it. So if you do a run walk, it works as a really good way to strengthen it, but give it recovery times throughout that run walk session. Excellent. I think that's pretty much everything I wanted to say about rehab. So let me give you a classic example of what can happen if you end up protecting your knee a little bit more than what you should. So somebody in the Facebook group had the following question. She wanted to know if she's torn her meniscus. On the 20th of Feb, so we're now in May, 26th of May, so that's 2 months ago about. March, April, May, that's 3 months ago now. She lost concentration but was busy on the rowing machine and she heard something pop in her knee, something strange happened. She left it for 2 weeks after because she had to go to a hospital for other big toe surgery and she was in a surgical boot for 6 weeks after that. And the knee was very swollen, both legs, from the surgery. So the surgeon pressed on the inside of the knee and said, well, it's likely a meniscus tear. and her GP gave her naproxen, and then she had a referral to Physio MSK, but then of course the coronavirus hit, so now she's not been able to get any help in that time. And at the moment she's limping, she's got lots of pain, she's got popping, her back of her knee is swollen, cramping in the calf, pain referring to her buttock, lower back, and can't get down to do any cleaning, handywoman, and she's got a job where she's got to do some things where she's on the floor, handywoman job, and she's scared that it's too late. What can she do about it? To be honest, it's never too late to start rehab. But I think unfortunately, because she's had that surgery period where she couldn't do much and she was in the boot, everything's just become really stiff and sore and lots of muscle spasm because she's not been given the right advice about how to move things. So if you want to improve this, of course it's best to see a therapist, but totally get it that you may not be able to consult somebody at this point. You want to gently start moving that leg so that you can get some circulation through it. But also, it is quite usual for, if you've got a meniscus tear, for the back of the knee to be swollen, because remember, the meniscus is inside the knee joint, and anything that causes irritation in the knee joint can cause a lot more synovial fluid to be produced. And then that swelling often shows towards the back of the knee that you'll see it. It's classic that somebody will be told that they've got a Baker's cyst as a diagnosis, and that drives me nuts, because often a Baker's cyst develops because something's irritating the inside of the knee. So it's producing more synovial fluid, and then the fluid presses a bubble out at the back, which is the Baker's cyst. So a Baker's cyst as a diagnosis is one of those things where I think maybe we should be looking at what's causing the Baker's cyst. In any case, that's rant aside. So if you're finding your calf is really tight, you do mention that it goes up into your back. So I would want to see if you don't have any back issue that's going with this, but it's very likely that it's just everything that's really tight. So I would try some gentle glute stretches, gentle hamstring stretches, gentle calf stretches to see if you can get that muscle spasm to just release. If we think of the nerve that may be causing a little bit of that pain up into your back, if it's really tight, be careful of strong hamstring stretches, because that can make it feel worse. But if we're thinking of gentle glute stretches, for instance, to start with, things like, let me see if I can show you in a chair. Things like, just if you're able to cross your knee, bringing it across while you're sitting and gently holding it and just pulling it over to the side, that can often give you a good stretch in your glute and feel quite comfortable when you're doing it. If we're thinking of a calf stretch, it's the classic one where you hold on to something for balance, and you've got your one leg behind. So this would be the injured one where the calf is stiff. And I'll show you more of that. There we go, that's what I'm doing. So my hind leg is straight, and I'm just leaning forwards until I feel a bit of a stretch. But you don't have to give a massive step, just give a step to where you feel comfortable and lean forwards and see what you can do with that. And you want to hold a calf stretch like this, where we want the muscle spasm to go, for about 30 to 40 seconds. Move everything a little bit, do a few repetitions. Okay. Now once you've loosened off your calf and you've loosened off your bum a little bit, then I would attempt a gentle hamstring stretch. And I would probably try something like just sitting with the leg out in front of you. Relax your foot, that you don't make it a nerve stretch. So if you pull your toes up, you're going to stretch the nerve more. So relax the foot down and just gently lean forwards until you feel a bit of a stretch behind the leg. And again, hold it there for about 20 to 30 seconds. As long as it's a comfortable stretch, it shouldn't be painful and shouldn't cause you more pain afterwards. Okay? Then get that leg moving. So either on the bed or while sitting, just get it moving, get that joint moving. And then see if you can start with simple things like just trying to get it straight out in front of you and holding it there for 10 seconds. That can already be a good one to just get this going. So that's the first type of things that I would start with. If you're getting all that cramping and all the muscles, I think honestly, it's a case of, because you've not been told what to do, it's just become more and more painful. that things have just tightened up, and that's causing a lot of your discomfort. So if you can get some movement through the knee, get those muscles to relax, and then start some gentle exercises, I think you'll be a lot more comfortable. But see if you can manage to find an appointment with a physio sooner rather than later. Don't worry about it. Even if it's a meniscus tear, your knee will get better still if you get help within the next couple of months. Okay. Excellent. So if anybody has any questions, you're welcome to ask them in the comments. And if you need more help with the injury, you're welcome to consult me via video call. The link to my website is in the description of this video. Take care.